Okay, Emily.
All right, good afternoon, everyone. Thanks for joining our webinar today. I'm Emily Beauregard. I'm the Director of Kentucky Voices for Health and a member of the ThriveKY Campaign. I recognize a lot of the folks who have joined today, so you probably already know a lot about our campaign, but for those of you who don't, Thrive Kentucky is a group of organizations working to meet the basic needs of every Kentuckian through systemic change. And I'll share a little bit more information about our principles and how we do that work a little bit later. But I just want to say that it's really hard to believe that it's been over a month since our last webinar and so much has happened. As always, our goal with these briefings is to make sure that you get the latest information on state and federal, the response to COVID-19, updates on our safety net programs, and have the opportunity to learn about ways that you can educate and advocate in your communities. We try not to repeat too much of what we've shared before and instead focus on what's changed in the last month, what we're anticipating for the future. Well, there has been a lot that's changed in the last month. And it can feel pretty overwhelming, I think, to a lot of us. Between the pandemic, the recession, the violence that we witnessed at the Capitol last Wednesday, racism and other forms of discrimination continue to be a threat to our democracy and to our health and our economic security. And as heavy as it feels right now, this is why we continue to advocate for policies that are anti-racist and anti-poverty so that all Kentuckians can thrive. Kelly, you can turn to the next slide. On that note, as I said, Thrive Kentucky is a campaign of organizations working to meet the basic needs of every Kentuckian through systemic change. We have shared principles. You can also see the list of our Thrive Kentucky partners. If you turn to the next slide, Kelly. Let's go ahead one more slide. And take a look at the agenda. So this is the agenda that we're going to be covering today. Each of our Thrive Kentucky partners will present on their areas of expertise. And before we begin, I just wanted to do a little bit of housekeeping. We have a lot of folks on the webinar today, so please be sure to mute your line. We are recording this webinar and we'll send it out as a link in a slide deck and a follow-up email. And we have, as speakers are presenting today, you can use the chat box for questions or comments. We'll try to cover those as we go. We do offer CEUs for certified community health workers and for licensed social workers. So if you're interested in getting CEUs for today, you can contact Kelly and we'll have her email address at the end of the presentation. And with that, I'm going to turn it over to Dr. Sheila Schuster to tell us about what's happening with the 2021 General Assembly.
I feel like we need to have our combat gear on. Good afternoon. I'm delighted to be talking with you. Next slide, please, Kelly. So as you all know, typically in the odd numbered years, we have a 30-day session. And usually the legislators come in on the first Tuesday after the first Monday, and they do mainly ceremonial things. They all get sworn in, they have their ethics training, they very often elect their leadership, they get their committee assignments, and then they go home for 3 weeks until part 2, which starts on the first Tuesday after the first Monday in February. This session is different. If you've been following in the newspaper or TV, radio, you know that they met on Saturday, which is a rarity, and they are meeting Monday, Tuesday, and Wednesday of this week. So they have moved 4 days into this part 1 from the part 2, and they are using this time to basically strip the governor of most of his emergency powers, to retract the emergency regulations that were passed this past year in 2020. They've passed 2 abortion bills. And all of these pieces of legislation, I think there will end up being 8 or 10 of them, are likely to be vetoed by the governor during this period. For those of you who don't remember your civics lesson, a bill can sit on the governor's desk for 10 days and become law without his signature, or he can sign it or he can veto it. But it has to happen within that 10 days. So when they have finished with part one, they also will have passed a one-year budget for fiscal year 2022. You may remember that instead of doing a biannual budget this last session, they were afraid to do budget planning too far out because they didn't know what the impact of COVID would be. The governor laid out a very robust 2022 budget with raises for state employees and a bonus for teachers. But the legislative leadership has pretty much poo-pooed that. They're being much more conservative. Some of this is a fight over how the federal funding will be used in the CARES Act. So we're waiting to see. What will happen in part two is that they will come back and they will override the governor's vetoes of all of those bills. And when they do that, then those bills, and most of them have an emergency clause, so they will go into effect immediately. The Republicans gained a bigger majority, I should say, a super majority in both the Senate and the House, so they will easily override the vetoes. Next slide, please, Kelly. So some of the things other than these very divisive things that we're looking at, there will be legislation around making sure that insurance and Medicaid payments for mental health and substance use disorder services are paid at a level that's commensurate with that. For physical health, we're really interested and very anxious for the telehealth rules, which have been loosened up during the COVID period to become permanent with statutory action. There will hopefully be some criminal justice reform. I think what we've seen with the Breonna Taylor and other incidents that there are many areas, and some of these have been on the agenda in past sessions, but haven't had the urgency that I think the Breonna Taylor situation has brought to it. We're working again, particularly with the Thrive group for protections against surprise billing. This is when you do your due diligence and you pick a surgeon, say in a hospital, they're in your network, and you go and have that surgery. And then 2 weeks later, you get a bill for a radiologist or an anesthesiologist. And some of those bills can be very hefty. And you really had no choice about who those providers were. And we're trying to do legislation that would hold the consumer harmless in that situation. There also has been a lot of talk in COVID. If something good has come out of COVID, I think it's been an emphasis and a focus on health disparities, which we've known have existed in Kentucky for quite a period of time, but I think have really been emphasized with the disproportionate number of our fellow Kentuckians who are Black or brown in terms of the severity of the disease and the mortality from it. And then certainly there are racial injustice issues that need to be addressed. We are concerned about some of the changes that have been made in the House and Senate rules. These are the internal rules that they make. They're not public. We can't debate them in public. And a couple of them are going to make it harder for us to have our bills move, the bills that we're supporting, or to know when they're going to be heard in committee. So the leadership has kind of grabbed the ability to decide whether to even assign a bill to committee. So we could have bills that are introduced that not only never get heard, but they never even get the light of day in a committee. And we're getting only 24 hours notice, if that, about what a committee agenda might be. We also don't have any clear way for ordinary citizens to be able to testify or to give comments about bills in committee. For those of you who have been in Frankfurt, you know that if a committee hearing is being held and you have some issues with the bill, you can go and sign up at the door. And if time is permitting, the chair will call on you to come and make a brief statement. We have not figured out any way that that's going to happen remotely. The best we can suggest to you at this point is that you send an email to the bill sponsor, to the committee chair, and to the LRC person in charge of that committee with your testimony. The annex and Capitol buildings are essentially going to be closed to visitors. You can arrange for a meeting of no more than 3 people with a legislator, but you'll have to get clearance from them to get admission into the building. And You can't stay in the building and then roam around and visit with other people. You're supposed to be able to leave the building immediately. We have an access guide that Emily and I have worked on, and it gets updated as we hear some developments, but I think it will give you at least some idea of what the parameters are. I think we're going to have to be even more of an Energizer bunny, keep on keeping on, to be persistent, creative, and very determined if we're going to have our voices heard. Next, Kelly, please. So let me turn it over to Kara Stewart, who's going to talk to us about the federal relief package. Thank you, Kara.
Hi, thank you, Dr. Schuster. So we passed the bill. We have a federal relief package. DC, we've been saying for months, like, it might happen, it could happen, please make your phone calls. It happened, but that's the good news. But of course, you can see we've made it along here. There's still some question marks in that last bubble, not because we don't know what's in it. We do. It passed at the end of December, but because we still don't know what's next, and it isn't, because what we know about this bill is that it isn't enough. It's like whatever that car commercial is, that we need that other government where you walk out the door with more. We need to get more, but what we have in here is some good stuff that gets us. If you want to go ahead and go to the next slide, that goes ahead and gets us to January. So basically, it is a bill that is sort of like a stopgap coverage situation that provides some pieces of the puzzle. So it makes sure that we add that $300 a month and that weekly unemployment bump, that FPUC, and it extends the unemployment for the gig workers and the self-employed, the PUA. That's a really big deal, but it only extends it until March 14th. That's just a few weeks away. So if there's anybody that thinks that we will have recovered from COVID-19 by March, I have some very unfortunate news for you, especially given that we now have new crises on the horizon based on last Wednesday and ongoing in DC. So this gets us this little bit, but it leaves out a lot. So one of the big things that it leaves out is there's nothing for state and local government. And of course, our state and local governments have pulled out all the stops really here in Kentucky to try to keep people safe and fill in gaps. And it doesn't leave any more money for Medicaid, which is also a problem because we have more people on Medicaid right now than ever before, obviously, because of our economic situation. And so this, while it sends the $600 relief checks to individuals, that I'm sure you'll be shocked to hear is not really enough to help the number of people who are unemployed and the number of people who have lost income from the pandemic. So what we're asking now in our Washington, D.C. segment is to still make phone calls, except for this time we're broadening it from not just Mitch McConnell, you can go to the next slide, but to everybody to let them know that we need more, that our economy needs much more aid, that we need to increase the relief payments. Of course, there is that conversation about moving the relief payments from $600 to $2 billion. We could say thank you for the ban on most surprise medical billing. That got added in here that you heard Dr. Schuster mention before about when you go somewhere and it isn't covered the way you think it should be because you went to an in-network provider, but there's another provider who wasn't a network. So some of that is now covered from this COVID bill, actually. And our child care centers got a little bit of money and we got a little bit of rental money, but it's about a third of what's actually needed. So we need to get back on the phone and say, this is helpful, but it's insufficient. And we need a long-term, long-lasting, big enough with all the key pieces solution. And to quote, I'm not sure if it's a combo of Jason Bailey and Dustin Pugel, we need an additional robust relief package, and it needs to be the first priority because we need more aid to build a bridge over this side of the crisis and jumpstart a strong and equitable recovery on the other side. You can steal their words too when you call. You can say their exact words. You don't have to make up new ones. I'm going to throw it over to the person I just quoted, Dustin Pugel.
There you go. And just to give credit where credit's due, I'm fairly sure Jason Bailey wrote that section. So yeah, just to reiterate what Kara said, this was a pretty decent package to accomplish what it set out to accomplish, which was essentially to get us through a couple of months. And it does just that. So in the meantime, we need to be thinking about what the next 12 months or longer are going to look like. And just, I want to point out using this chart here, folks will remember, obviously in April, we shut down a lot of businesses in an attempt to get a jump on providing enough PPE, getting systems in place for contact tracing, expanding our hospital capacity. And so we tried to buy ourselves some time by shutting things down. That in combination with just a naturally depressed demand in anticipation of a downturn led to this huge drop, this slide in jobs that you see there going from March to April. And then what happened is we got the CARES Act. And when the CARES Act kicked into play, we had extra stimulus money in the form of the $1,200 checks. We had some state and local aid in the form of CRF monies. We had enhanced unemployment benefits, and we had a new form of unemployment benefits in PUA and PUC. And that's really what got us on the rebound between May and June. And so I say all that to say, when we take federal relief seriously and we put a large price tag behind it to make sure that we're taking care of our people, we can get results. And we saw those results, and they were very effective. They helped a lot of folks. But then the money ran out. FPUC really stopped being issued at the end of July. The stimulus checks all got spent. CRF money spending slowed down. And so then what we ended up seeing was, in the middle of the pandemic, exactly what you would expect to see, which is sort of a petering out of our recovery. So as of November, the latest data we have for Kentucky, we have national data, which did not look good. But for Kentucky, we're at 1.8 million, which is about 100,000 jobs shy of where we were before the pandemic started. We've recovered a little over 2/3 of the jobs that we lost, but that means that we're still 5% below where we were in February. There's still a lot of people not working, even though they would like to in many cases. But even if even if we did have a lot of jobs that were available, which we don't, there's still a pandemic going on. And a lot of folks who are immunocompromised or live with older loved ones or loved ones who are immunocompromised are staying home for good reason. And so we need to make sure that we are supporting folks in that situation. I'll say that, well, actually, let's move on to the next slide. So, this stalled recovery has really been uneven. If you're white in Kentucky, as you might imagine, it's actually been okay. A lot of white folks have recovered their jobs. There's been about a 78% reduction in the number of unemployment claims for white Kentuckians. But if you're Black, you are overrepresented in unemployment claims, meaning there has been a higher rate of layoffs for Black Kentuckians. So far, unemployment claims have only dropped about 68% for Black Kentucky workers. This is true, generally speaking, for Kentucky. Nationally, what we've seen is this sort of second bullet on the right. There was a drop in December of 140,000 jobs, all of which was represented by women. And if you actually break it down by race, then the vast majority of it was women of color. And so, there's actually a really interesting report out by the Federal Reserve of, I've actually got it open here, and I can put it in the chat after I'm done. The Federal Reserve Bank of St. Louis that actually looks at the way the recession has affected women, and especially women of color. And it's been really remarkable in a bad way, how lopsided this recession has been and how much it's fallen on women, and particularly women of color. I'll just say that when we get Kentucky specific data, we won't be able to break it down to that fine-tuned degree, but we will be able to kind of see generally what the picture is, and we should get that data in a couple of weeks. So let's move on to the next slide. what we're also seeing pretty consistently is that if you earn over $60,000 a year in Kentucky, you're not really feeling the effects of the pandemic economically. In fact, high wage jobs are slightly up over where they were in January of 2020. So this is really a recession for middle and low income earners in Kentucky and across the nation. So on average, there's a 7.3% decline in jobs from last January. For middle wage earners, it's negative 5.5, but for low income earners, it's negative 15%, which makes sense if you think about the industries that have been hurt the most, specifically leisure and hospitality. So think, hotels and motels, food service workers. So that's restaurants and takeout places, and then also some forms of construction that have really slowed down in the middle of all this. So, this has been a recession that has been born on the backs of low-income workers in Kentucky and across the nation, which is one reason why things like $2,000 checks are so important. If you are a low-income earner and the average earner in the bottom 20% is around $11,000, a $2,000 check is a huge increase to your income and could mean the difference between being able to stay in your apartment here in a month when the moratorium runs out. And obviously, Adrian will have more to say about that. Or it may mean the difference between being able to put gas in your car to get to your whatever work you can find, or keeping your lights and heat on, and on and on. So direct cash payments to low-income folks really do make an enormous difference. And that's what's incredibly needed right now, in addition to other targeted aid for low-income folks like SNAP that Jessica will talk about, because that's really where the suffering is being felt most acutely. So let's move on to the next slide. I'm going to talk a little bit about unemployment insurance, speaking of job loss, because there's been a lot going on with that. Kara, I think, did a very good job giving an overview of where things stand with the new bill. I'm going to talk a little bit more about that in a minute. But just so folks can see sort of a week-by-week explanation of where our unemployment benefits are. If you look at this bar graph here to the left, the light blue bars are PUA, which is that special program set up by the CARES Act for gig workers, independent contractors, as well as folks who are directly affected by COVID, either because their childcare or school shut down and they need to stay home to give caretaking responsibilities, or because they've been told to quarantine because they are suspected to have COVID and other COVID-related reasons. And that bar had been growing in recent weeks, and so did our regular unemployment program, especially as things started to worsen. So this goes all the way up to January 2nd, and you'll notice that the light blue bar disappears. That's because we've hit a gap between when PUA was initially supposed to expire and the time when it's going to take the state to get it back up and running, because the state had been working off of the assumption that December 26th was the last week for PUA payments. And if you all remember us saying in the past, we have a Nixon era computer system that handles these claims. So, we're talking about a computer mainframe that was last updated in the 1970s. And those are what we use to make changes to our unemployment program. So, that was hard baked into our system, and it's going to take a little bit to turn that around and bring it back online and start being able to provide PUA again. So in the meantime, we're going to see a further backup of initial claims that people are filing that we're just not going to be able to get to until we're able to get that computer system back up and running for PUA in particular, as well as it doesn't seem like there was as much of a problem for PEUC, which is that extra program for regular UI benefits. But in any case, we're staring down a very similar cliff, as Kara said. So let's move on to the next slide. So March 14th, we're going to be facing the exact same situation we were facing with December 26th, where we have multiple programs that are set to expire. And unless Congress acts quickly and decisively to give states enough lead time to be able to get their systems tooled for these new changes, we're going to face another gap, which means more hardship for folks who have already been struggling for months. So PUA, these special COVID-related benefits, PEUC, the extension of regular UI benefits, PUC, which is an extra $300 instead of $600 per week, which that will be very helpful for a lot of folks, especially folks who are getting PUA and low-income regular UI folks who are getting under $200 a week, in some cases as low as $39 a week in regular UI benefits. And then there's also a special $100 benefit for folks who have mixed incomes between traditional employment and self-employment. So before there was a problem where people's wages looked artificially low if, say, they had a part-time job, but they also were running a business on the side. And so their benefits ended up being too low. As a way of working around that without having to try and juggle two different programs, PUA and regular UI, the federal government's going to add an additional $100 to folks with mixed incomes, which will be very helpful and keep a lot of folks who were left out the first time sort of back made whole. In addition to that, the governor announced two programs as part of his budget address, but we're fairly sure that he is going to move ahead without it because he's going to be using some of the remainder of our CARES Act money that the state got, that the Coronavirus Relief Fund dollars. So one of those is a $1,000 payment to claimants who have been waiting for longer than 2 months. And as last I saw, there are over 80,000 of those folks who have been waiting far too long for those benefits for all the reasons we've already explained. In addition to $400 one-time payments to the folks who are left out of President Trump's Lost Wages Assistance Program. Some folks may remember that after FPUC, the $600 weekly added benefit expired, the president utilized money from FEMA to provide a 6-week span of $300 benefits if states kicked in an extra $100. But that was only for folks who were earning benefits of $100 or more. And it left out some other folks besides that. So this is an attempt to try and back pay at least 1 week of those benefits, which again, in the middle of really still a very real downturn for folks who are unemployed, that will be very useful. But ultimately, we need to stop moving the goalposts and, making policy from cliff to cliff. What we really need is a permanent change to our federal unemployment program so that we have automatic stabilizers that act in times of crisis like this and not try and orient ourselves toward new deadlines. So there have been some proposals around that by Ron Wyden and others. There are rumors about this being in the next aid package, some form of permanent stabilizing mechanism for enhanced UI benefits. But really, that's something that we need to be very conscious of as there are conversations around UI. And there are ways too that the state needs to modernize our program. So one, we don't end up with massive backlogs in the future. But two, we have an unemployment program that works for a modern workforce, which ours is still really designed for a workforce of the 1930s. And we have not done a good job of updating it since then. So with that, I'm going to go ahead and hand it off to our next presenter, who I believe is Adrienne Bush.
Hi, everyone. It's good to be with you. My name is Adrienne Bush. I'm with the Homeless and Housing Coalition of Kentucky. Next slide. Okay, so evictions remain the looming crisis that we are all concerned about. The CDC eviction order was issued on September 4th. It was supposed to expire on December 31st. As part of the late-breaking COVID deal at the end of December, this moratorium was extended for 1 month through January 31st. No additional protections, no closing of the loopholes, but it does cover renters from being evicted for non-payment of rent. The next bullet points go over who a covered person is and that sort of thing. Next slide. Okay, so we still have folks using this homerenterDeclaration.org, this app that was created by Kentucky Equal Justice Center, which on one hand, I hate that it is still necessary. On the other hand, I'm glad it's being used. So if you know of anyone, please continue to share this tool. It's still valid through the month of January. Next slide. Okay, so a few months ago, I started taking a look at the Metro United Way 211 data just to see what people are calling about. And the numbers keep increasing for housing and shelter, basically by a percentage point every month. And of the housing and shelter calls, rent assistance consistently remains the largest portion, and it also is increasing basically by a percentage point each month. Next slide. According to the latest census household pulse data, we've got 20% of our Kentucky renters who are behind on rent. 58% of Black home renters are behind, and 37% of Hispanic or Latino renters are also behind. 37% of all renting households have no confidence in their ability to make next month's rent. And 44% of all home renters think it is somewhat to very likely they will have to leave their home due to eviction in the next 2 months. Now, this data was pulled before the current COVID package that was finally approved 2 weeks ago. But this just shows you, I mean, we're at the brink, right? So next slide. Okay, as part of the federal package, we finally have some broad-based rent assistance coming from the federal government. And that is to keep people who are currently housed and renting in their homes. Nationwide, we have about $25 billion available. Kentucky is eligible to receive $297 million, roughly. Now, of that, Jefferson County will get a portion, and Lexington, Fayette County also meets the threshold for this, so they will be getting a portion. So whatever Kentucky gets, it'll be subtracted from that 296 and some change figure. Here's the thing, right now, we're kind of just in a holding pattern, waiting for this emergency rental assistance to come to the states. All states and jurisdictions who qualify for this money have until tomorrow to register with the Department of Treasury. I believe all 3 jurisdictions in Kentucky have already done that. But then it's a matter of the feds releasing the money to the states and the cities. So the other thing to know is that statewide rapid rehousing assistance continues to be available, and you can contact, and that is for people who are literally homeless and need to be rehoused. You can contact Kentucky Housing Corporation for a list of providers that's based on regions outside of Lexington and Louisville. As I mentioned before, Lexington will be administering its own emergency rental assistance fund. In the meantime, you can visit that website there on the screen. And then in Louisville, we had $21 million designated in rental assistance over the summer. And there will be likely more money because of this emergency rental assistance added to that pot. In the meantime, you can go to stopmyevictions.org. Next slide. Okay.
Can you hear me? This is Natalie from Louisville.
Yes.
And they are not taking any applications at this point. All they are doing is trying to serve all the people who had already applied. So you can go to stopmyeviction.org, and we're telling people to do that so that you'll know when money is available, but you can't submit an application right now.
So Louisville is also in a holding pattern. That is good to know. Thank you. All right. The next slide, we are continuing to collect stories of people who are experiencing housing insecurity or homelessness. We want to connect these folks to policymakers, to the press, and also, of course, as resources become available, connect them with these resources. So Please continue to share our story collector. You can go to our website, hhck.org, to do that. Next slide. And the current call to action to the federal government is very clearly to extend and expand the eviction moratorium. The current one is okay, and I'm glad it's in place, but really we need a comprehensive uniform eviction moratorium because the virus does not care if you got evicted for non-payment of rent or because you left your garbage cans out for too long and your landlord pressed you on a lease violation. So the National Low-Income Housing Coalition has an organizational sign-on letter going to the Biden administration. You can add your organization to this before January 15th. That is the deadline. We also need additional investment in Emergency Solutions Grant, CV, and by CV, I just mean emergency funds. And additional emergency rental assistance is critical. This current allocation is great, but as Kara said, essentially it's a down payment only. And with that, I will turn it over to the next presenter, Jessica Klein.
Hi, I'm Jessica Klein. I'm a policy associate with the Kentucky Center for Economic Policy. Next slide. So based on the unemployment and housing information you just heard, it shouldn't be much of a surprise that food insecurity is also an issue in Kentucky. According to the latest Census Household Pulse data, about 14% of adults in Kentucky report that their households don't have enough to eat. And that is reflected here in our SNAP participation data as well. We've seen increases of over 118,000 Kentuckians using SNAP to buy groceries since the pandemic began in March. So the latest increase was in December of about 37,000 people. And our estimates are that a lot of that has to do with the loss of initial supports. So these largest increases are all across the state, both urban and rural counties from Louisville to Magoffin and Lee. So as the pandemic continues and other supports end, we will likely see more benefits like SNAP being used. Next slide. So a few things are happening within the SNAP program to provide additional support. One, Kara mentioned the 15% increase in SNAP maximum benefits, and this is through June 2021 included in the new federal relief package, which is really exciting to see. This ensures that even those with the lowest incomes who are already receiving that maximum benefit before the pandemic are able to continue getting additional support that they need during the pandemic. So a few other nutrition-related supports that were in that federal package I just wanted to mention were some additional funding for food banks and for senior meals, which were good to see as well. A few things the state is working on to improve SNAP is providing the emergency SNAP benefits, and that ensures that every SNAP household is able to receive the maximum benefit. So we were just approved for January, and that means an additional 200,000 households will receive about $200 extra this month to their SNAP benefit. A few other flexibilities within the SNAP and WIC programs. We've extended recertifications for 6 months. We've also minimized in-person appointments for both SNAP and WIC. That includes all of the labs and additional appointments that are necessary for the WIC program, and are providing income self-verification for SNAP. One thing we would still like to see is that SNAP increase I mentioned, the 15%, that it extend beyond the June 2021 deadline throughout the economic downturn. Next slide. Okay, a little bit about P-EBT, pandemic EBT. So just a few updates here. So for the August and September 2020 version, that went out in November and December. So now all of those cards have been sent. This is what the card looks like, and it comes in a very blank and plain envelope, so it's kind of hard to identify. But each individual child who participates in a free and reduced lunch program would have received this money in the mail during November and December, and it equates to about $252 total if they qualify for every possible day during those months. Next slide. So since all of round 2 has been sent, that August and September, we're now waiting on round 3. And I do have a few updates here. So for round 3, DCBS, our Department for Community-Based Services, recently received some additional information and are working on their round 3 plan. This is going to cover from October to September 2021. So there will likely be an initial high payment that covers October through December. Eligible students are going to be those that participate in free and reduced meals, have all virtual classes, or a hybrid where their classes are 5 days virtual in a row. This will also include some preschool and childcare centers. So some younger students will also be receiving this benefit. And a few additional pieces to this that we've recently learned. It's possible that they'll be using the same card during this next round. So if you have received your P-EBT card, be sure to keep it. And that should be coming out towards the end of January. We'll have more information on the P-EBT program. I think that's it for me. Next slide. Yeah, on to Priscilla. Thanks.
Hello, I'm Priscilla. I'm the outreach coordinator for Kentucky Voices for Health, and I'll be doing the health coverage updates. So the big update that's most important right this second is that public health state of emergency has been extended another 90 days to April 20th, excuse me. This is excellent and great news for Kentucky because that means Kentuckians that are enrolled in regular Medicaid can't be disenrolled except for moving out of the state in case of death or if an individual requests it. It also extends the enhanced FMAP matching for Kentucky, which helps offset the state budget cost. It also extends other important waivers related to making it easier to provide care during a pandemic. So Medicaid, there's still $0 Medicaid copays for Kentuckians and MCOs, a $1 Medicaid copay for Kentuckians enrolled in fee-for-service. One of the great updates that happened this year was a universal formulary for Kentucky for the MCOs. And thankfully, MCO selection period has been extended to March 15th. Some of the overarching things for all insurers, COVID-19 tests should be free, but we have still been hearing some occurrences of balance billing. If you do receive a bill, definitely check out the KEJC blog and complete that form that is linked in this presentation. The same with vaccines, they should be free, but it's still quite new. So we haven't quite heard a lot about whether or not there is any billing associated with that. But if you do hear anything, if something does come up, definitely feel free to reach out and let us know. And in 2021, actually, 2020 marketplace plan, 83,000 Kentuckians enrolled in a marketplace plan, and 92% of them had financial assistance, whether that's the tax credit or cost sharing reductions, which is pretty cool. Next slide, please. So Medicaid coverage in Kentucky, right? This map right now is showing where 1 in 6 are covered by 1 in 6 Kentuckians covered by Medicaid are Kentuckians of color. If you look at like Jefferson County, 48% of Medicaid enrollees are non-white. Fayette County is 36%, Christian County 40%, and even Hardin County is 21%. So that's a pretty high percentage. And all of that just really reemphasizes the idea that non-white Kentuckians are have a lower socioeconomic status, which leads to an increase of eligibility for Medicaid, which reiterates Dustin's point that non-white Kentuckians are being hit especially hard during this pandemic. So something to keep in mind. Next slide, please. So some of the recent changes to temporary and regular Medicaid. So for regular Medicaid, all Medicaid members right now who are currently enrolled in regular coverage have until March 15th to change their MCO selection. It doesn't matter if you changed it back in December, you can still change it now until March 15th. All new Medicaid enrollees who don't select an MCO when completing the regular application will be enrolled in United Healthcare. Kentuckians who have a household income below that 138% of the federal poverty line, you should definitely apply for regular Medicaid anytime during the year, and you can do that on Connect, which is back, yes. Some of the changes to temporary Medicaid, starting January 1st, PE Medicaid is completely covered by United Healthcare, which is Kentucky's new MCO. So Kentuckians who did have PE as of December 2020, they were automatically enrolled in United Healthcare. That coverage starts January 1st, ends March 31st. A lot of people we've heard they got a notice from United Healthcare before they got anything from the cabinet, but that's just to let you know that's what's happening. And then PE members, if you do have it, please complete a full Medicaid application before March 31st. And at that point, you would still have another 90 days to change your MCO after that. Next slide, please. Okay, so just a couple of reminders about PE. So to be eligible for PE, you have to be under the age of 65. If you have any sort of health insurance that covers doctors, pharmacy, or hospital visits, you're not eligible for PE. And make sure that individuals should accurately report their household income. Thankfully, one of the things that we just heard today was that the PE application will remain publicly available, which you can access on the website. I linked it here. And then starting January 30th, 2021, so at the end of this month, DMS is going to start denying applications for individuals whose reported income exceeds that 138%, or if you're over 65 years old. That's something that they have to do, but just keep that in mind as we move forward. Next slide, please. Okay, whoop. Next slide. Or not.
Priscilla, it could be that Kelly's screen has frozen. I can try to share my screen if I can override hers. Give me just a second.
Totally cool. Don't you love technology sometimes?
Yeah, it's the best.
It's better than COVID. You know, I'd rather have a pause and a screen reshare and a break than us have a terrible respiratory virus. So
good point. You know, it's all about like making sure you keep everything in context.
Can you see my screen now?
Yeah.
Ish? Yes. Yeah.
yes.
Here we go.
Okay. Perfect. So since Medicaid open enrollment is still open, these are the 6 current MCOs that are available in Kentucky. There's more information with this nice side-by-side comparison. Definitely check it out because it's important to really look at the MCOs that you're working with, that you're going to be choosing, and just know what they offer, what extra benefits, because they're competing for you, not, you know, the other way around. So next slide, please. Okay. And as I mentioned earlier, there is a statewide universal formulary that can be accessed on that Magellan Medicaid portal. That's when you pull it up, this is what it looks like. And then you can search for whatever medications that you need so that you can have a better idea. And each MCO also has a separate supplemental formulary, which we're going to be talking to the cabinet a little bit more to get a little bit more information about what that looks like. But in the meantime, here's a link to each MCO's formulary. Next slide, please. Okay, and then there are also some new prior authorization updates that'll be starting February 1st. So all PE requests for inpatient Medicaid services will remain suspended. For MCOs, that does mean both participating and non-participating providers. All PA requests for covered for substance use and behavioral health services will remain suspended. Again, for both for participating and non-participating providers for MCOs. PA requests are still going to be required for outpatient Medicaid services with everything with the exception of COVID diagnosis, all the services related to COVID and all of that jazz. They'll still be required for pharmacy benefits, again, with the exception of MAT products. And then you'll still have to have a PA will be required for all non-Kentucky Medicaid enrolled physicians care providers. Next slide, please. Thank you. And so the last thing, the ACA lawsuit, it was argued in front of the Supreme Court back in November 10th. So that feels like a year ago, just a couple months ago. It still is going to be decided by the court at some point. We still expect a decision to come down, but the sort of upside at this point is because of Georgia and Biden winning, we are sort of entering this with a much more optimistic view that if Supreme Court decides that some part of this is unconstitutional, we will maybe have a more friendly and willing to fix the problem Congress in place, that they're more willing, all of this problem could be fixed with just Congress making that decision. So hopefully, if that's what happens, Congress will act and take care of that. But if not, we know what we got to do. So I think that should be it. Next slide. And so handing this off to Dr. Schuster. Thank you.
Thank you very much, Priscilla. Welcome to the team. We're glad to have you. Next slide, please. Is that Emily? So we've talked before about the twin pandemics of COVID and racial injustice. And I think we have to, from a behavioral health point of view, we have to recognize that the horrifying events at the US Capitol have added to the general angst of everyone in America. And so instead of talking about when you recognize that you're having some mental health issues, I think we all have to just acknowledge that all of us in some form or another are having some mental health issues. And these tumultuous times can take a toll on both our mental and our physical health. So we've talked about the most common symptoms are anxiety, depression. We have to add isolation. I think as these times have gone on and on, particularly with the high community rate in almost every county of Kentucky and people being much more careful, much more scared about going out. And we hear about outbursts of anger and frustration. We know that people are self-medicating, which is a polite way of saying that they're trying to dull their feelings by using alcohol or other substances to cope. And I think that to be realistic, we need to look at ourselves and the people that we love and reach out to them. It's really, really, really helpful to talk about how you feel. So I really encourage people. I find myself on the phone with old friends that live outside of Kentucky that I don't have time typically to talk with, but it's nice to talk to people that I have a shared history with from years ago and be able to hear from them and to be able to share my own feelings and to hear about theirs. It's really helpful to do something positive for somebody else, to take the focus away from yourself in many ways and to turn it to somebody else. Really get some exercise. Those endorphins are a natural antidepressant. And so if you have to stay in the house, develop a little route. I have a little route because I've kind of circular rooms and I kind of walk around when it's too cold to get outside. Stick to a routine. I've always said to people in therapy over the years, start a to-do list for the day. And the first thing you put on your to-do list is that you're going to make a list. And then you can cross that one off. So you've already accomplished something. And I'm being a little bit facetious, but not really. I think we have to have a sense that things are changing, even if they're very small things. Pick something that you want to spend a little time with. I'm hearing people say, I've decided that I'm going to spend at least 20 minutes doing some reading for pleasure, which I don't do. I'm going to limit my TV time, my news time to a certain amount of time. Focus on the positives. And I really encourage you to seek help earlier rather than waiting until you feel overwhelmed or desperate. Because at that point, the panic sets in and we don't want you to do something that's going to hurt yourself or somebody else. There are crisis lines available. The local community mental health centers are open for business. I'm a psychologist. I work closely with the Kentucky Psychological Association. All of our practicing clinicians are available. They're available by telehealth. So you don't have to get in your car. You don't have to negotiate. You can actually reach out to somebody who's on the other side of the state if somebody's been recommended to you. There is an immediate suicide prevention or talk line available, and we have that number there. But I really encourage you to be a little introspective and to be aware of what is really a natural outcome of this horrible time that we've been in really since mid-March. So there are people that you've not been able to see. Reach out and try to figure out how you can focus on the positives, and don't hesitate to reach out for some professional help. Next slide, please, Emily. So we've talked before about the SUD, a substance use disorder waiver. The 2020 General Assembly commanded the Department for Medicaid Services to work on a waiver that would provide services for incarcerated Kentuckians. And we know that there's a very high correlation between substance use and the likelihood that you're going to be incarcerated. We've actually worked at some criminal justice reform to get some of those long prison terms for marijuana possession, for instance. So we have people that are serving years in prison for having possessed marijuana when they were young. So we know that there are a lot of people that are in incarceration that need substance use disorder treatment. So we had a 30-day comment period here in Kentucky, and I think about a dozen organizations sent some comments, some recommended changes in language, and raised some questions because we were concerned about a couple of things. We didn't see a lot of change in the waiver that was submitted after those comments and then was submitted to CMS, the Center for Medicare and Medicaid Services. So then a federal comment period opened, and KVH and Thrive did a good job of letting people know that those comments were available. That ended just this past Friday, and we're waiting for the response from CMS. It's not that we're opposed to this waiver. We just want to be sure that it's successful. And we do have concerns about people being kept in incarceration in order to complete their service, to complete their substance use disorder services. And obviously we don't want that. We want people to get treatment in the community. We know that people are much more likely to stay sober and clean if they get treatment and if their community support system is involved in that. So those are some of the things. We also know from a clinical standpoint that very often substance use disorder and mental illness are intertwined. They occur at the same time, and probably 70% of the people. And they were making a distinction in this waiver that they would only include people for whom their first diagnosis or their primary diagnosis was substance use disorder. And we really push back hard as clinicians against that, because it's really a matter of where you are in your mental illness or substance use about what gets called the number one problem or the number two problem. We feel like anybody who has a substance use disorder and is in incarceration should get this treatment. So stay tuned. We will let you know. We may have something to report at our next monthly update, actually. And the next, please. So telehealth is one of the good things that's come out of the pandemic. I can tell you as a clinician, although I don't practice anymore, but working closely as I do with the Psychological Association and with the mental health centers and the Mental Health Coalition, that there probably was not 2% of the behavioral health services provided through telehealth before COVID. And now it's up to like 98%. So people have learned, both the providers and their patients have learned to use telehealth. And almost universally, it is being hailed as a real improvement. It has overcome transportation problems, which is a huge problem for many of our patients. It has, Dustin talked about how few people are employed and how people are trying to cobble together different employment. It has allowed people the flexibility to get an appointment without travel so that they can squeeze it in at a lunch hour or between one job, job one and job two, that kind of thing. It's not perfect for every kind of patient that we see. Very hard to treat young children, as you can imagine. Persons who are on the autism spectrum disorder have problems with it. Some of it is technical. Older Kentuckians may not be as comfortable and may not be able to handle the telehealth part of it. And then we know that we don't have broadband in large segments of Kentucky. And there actually has been, I think, a greater support from the physical and behavioral health providers to get broadband in all of Kentucky. So there is a bill, House Bill 140 has been filed by Representative Deanna Frazier, who is an audiologist from Richmond. And it's a very comprehensive bill that would put into Kentucky statute much of what is now available because of the changes that were made by the feds through CMS and then incorporated into the governor's executive orders. So for instance, in the past, you've not been able to use just a telephone to provide health services, either physical health or behavioral health. And under the pandemic rules, you've been able to use a telephone. And that will be included in this legislation. And the importance of that, again, is if you're doing crisis intervention, it's really, really important that somebody who has some behavioral health knowledge or physical health knowledge is able to reach that person immediately and offer some counsel in the throes of the crisis. We also want to be sure that providers are reimbursed to the same degree that they would be reimbursed if they were doing those services in person. And it also gets rid of some barriers that have been there. In the past, there's been a requirement that you had to have seen the person in person or face-to-face for so many sessions before you could use telehealth, and those have been removed. So we're hopeful about passage of House Bill 140, and we will certainly keep you notified about the bill as it moves forward. And I think I'm at the end of my, are you ready, Emily, by handing off to you? Next slide. I think Emily is frozen, so maybe we're all frozen now. Kelly?
She just came back.
Oh, she just came back. Okay.
Yeah.
I think we're ready for you, Emily. You're muted. There we go.
Saw that. Thank you. I think it might be my connection that's going in and out. So Kelly, if you can maybe take over if anything happens. So let's see. I want to share some updated resources for advocates and consumers. The first is a sign-on letter that we are helping our partners at ACLU Kentucky circulate. And this sign-on letter is asking Governor Beshear to prioritize vaccines for incarcerated Kentuckians. We know we've heard many, many accounts of Kentuckians who are incarcerated getting COVID-19. Some have died, but it's just impractical for people to social distance, and for many, many reasons in congregate living, it's incredibly important that people get the vaccine as soon as possible. So there's a link here to the sign-on letter, and the deadline is this Friday. So I hope that you will consider signing on for your organization or share this with other groups that you think might be interested. For renters, there are, I think, all of the same resources that Adrian shared earlier linked here. And for landlords, information about some funding for landlords in Covington specifically. Homeless assistance, there's some information there for Lexington, Louisville, and then the coordinated entry lead agency contact list, which you can click that link to access. For utility assistance for homeowners, there is a year-round light heat program now, and to apply, homeowners can contact their local community action agency. There had been another emergency utility fund, and that fund, which was created by the governor, that is now, I think, empty. So this is the current assistance that's available for utilities. Other resources, we have previously linked to the ACLU Kentucky, that should say Kentucky, Reentry Resource Guide. So that's for really helping to make sure that as Kentuckians are leaving incarceration and going back to their communities, that they're as successful as possible, have the resources necessary to make that transition. There are free mental health screenings provided by the Mental Health America of Kentucky. All of these links are live, and you'll get them in our follow-up email. The General Assembly Access Guide is also linked here. That's something that Sheila talked about previously. And I included links again to the temporary Medicaid application and to Connect. So we mentioned Connect on our previous call. Just a reminder, it is now the portal for Medicaid, SNAP, KTAP, child care assistance, and also has a new resources hub for things like food assistance, housing, employment services, and more. And United Way, I linked to that as well. The state is in the process of partnering with United Way to cover all 120 counties. These are also links that we've shared in the past to Medicaid, SNAP, and COVID-19 trackers that the KY policy folks have been keeping updated. So very thankful for the work they do to keep those updated and help these programs be more transparent. And then legal aid, we have 4 legal aid programs that serve Kentucky, and we have contact information here and more information at the link. For stimulus checks. Now, this is information that we shared when the $1,200 stimulus checks were first going out last year. We assume that the same information or the same tool can be used for the $600 stimulus check, but we actually haven't gotten that guidance yet. Just yesterday, Dustin Pugel checked the site and it wasn't updated for this latest round. So when we get more information, we'll be sure to share it. And these are links for food assistance. Also, Jessica added in the Kentucky Food Policy Network, which she shared about in our December webinar. So if you want more information, you can go to those links. Story banking. So KVH, it continues to story bank. I hope you've seen some of the wonderful videos that we've put out over the past month or so. We have been highlighting the stories of people who have Medicaid and have been using Connect and can talk about how it's been valuable in their life. So if you know somebody who may want to tell their story, if you have a story to tell, you don't necessarily have to have Medicaid yourself. You could be a connector, a community health worker, a provider, someone who works with Medicaid members. You can contact me and we can talk about getting that started. Adrian mentioned that the Homeless and Housing Coalition of Kentucky is also looking to share stories of people about housing during COVID-19. So you can visit the website and look at their housing story collector. And we will be actually doing more story collecting in 2021 than ever before. So we will start sharing more and more videos as the year progresses. Also, be sure to mark your calendars for upcoming webinars that we'll be hosting. We have a Thrive Kentucky Forum with the Cabinet for Health and Family Services leadership on February 1st. Now, this is a quarterly forum. We had our first quarterly forum in November. It's already time for our second. We'll be covering a lot of things during this forum, but we will be covering the General Assembly again, as well as vaccinations and Medicaid, SNAP, P-EBT, all of the usual safety net programs that we like to update folks on. And it's a great opportunity to ask questions. So we'll get that link out to everyone in the follow-up email. And then I've included all of the dates for our state and federal policy updates for the rest of the year. So we have these scheduled out until December. Hopefully you can get those on your calendar. We'll start to make registration links so people can register in advance. And then I'm going to continue sharing Sheila's Advocacy 101 training because it is evergreen. This is a training that will always help you. And even if you've seen it before, go back to it and you'll learn something new. And we do have CE credits for the training, the Advocacy 101 training for community health workers and for licensed social workers, as well as for these ThriveKY updates. So if you want CE credit, you can contact Kelly at this email address or just respond to the email that we send out tomorrow. And that covers it for me. I haven't been looking to see if we have any questions in the chat. So, and here's our contact information if people want to get in touch. Have any questions come in?
I didn't see any questions, but an update came in from Natalie about utility assistance, and an update came in from Dustin that they have now updated the FAQ from the IRS around the second round of payments. So the links are in the chat.
Probably because Dustin looked yesterday. They
Well,
realized they were delayed in updating it.
well, I was looking in the wrong place yesterday and then ended up finding it toward the end of our call, but I guess I didn't make that known enough. But yeah, there are links in the chat for various places where you can find more information on it. You can check your stimulus payment for the second round, or you can get information on claiming a rebate credit if you were underpaid in the first round.
Okay, that's good information to have. And Natalie, thank you for sharing that additional information about Jefferson County. We can download this chat and also share it along with everything else in case there's something in here that you want to go back to. Unless there are any other questions, I think we can wrap up a little bit early today. I'll just give it a second. All right. Well, thanks everyone. And we'll see you in February.
Thank you.
Thanks.